It may be one of the most underestimated causes of death in developing countries: pollution. The World Health Organization says more than 8 million people die around the world each year as a result of living in a polluted environment. Here in Kampala, Dr. Kiggundu Tamale says the effects of air pollution are becoming more and more noticeable.
Air pollution has become one of the biggest challenges faced in Uganda, especially in urban centers. In Uganda, the main cause of air pollution is transport, especially rapid motorization that is being experienced in urban centers. But then there are other causes like mining, for example, open waste burning.
Doctors say it's often difficult to tie someone's health problems specifically to air pollution. In recent years, though, doctors in Uganda have seen an increase in the number of patients with lung problems. Dr. Worodria says air pollution has multiple effects.
And particularly affecting the lungs, the heart, and other body systems. In the lungs, you may have chronic lung diseases like bronchial asthma, chronic obstructive lung diseases. Even lung cancer has been reported associated with air pollution.
Worldwide, the WHO says pollution kills more people than malaria, HIV/AIDS, and tuberculosis combined. Yet pollution often remains under the radar of policymakers. Studies by Ugandan scientists suggest that about 14% of children between the ages of 8 and 14 living in Kampala have bronchial asthma. Dr. Worodria says researchers found similar results in one of Uganda's rural districts.
They looked at other forms of pollution, which include indoor pollution from smoke and other things. And again, about 14% of inhabitants in that rural district had some form of chronic obstructive lung disease.
Scientists and health officials say one of the reasons air pollution is not a higher priority is that it's less visible than other problems.
For example, if you have poor road infrastructure, this is visible now. If you don't have electricity, this is visible. So our politicians tend to focus more on problems that are visited by people. But air pollution is less visible, and therefore our decision makers or policy makers do not see it as a priority.
Recently, however, Ugandan health officials and the government have started a campaign to raise awareness about lung diseases caused by air pollution. One suggested approach includes trying to get people out of their cars and walking before Uganda becomes congested not only by cars but by the exhaust fumes. Serginho Rosplat for VOA News, Kampala.